Good day, everyone. I'm Dr. Victoria-Guillano, a Filipino IPC counselor. I'm also a fellow of the Philippine Dermatological Society and president of the Psoriasis Foundation of the Philippines. I'm deeply grateful to be part of the IPC Council and honored to have this opportunity to share our efforts in improving psoriasis care in the Philippines. Thank you, IPC, for this opportunity to share our work in this platform. To begin, as a passionate advocate for psoriasis care, I am committed to improving the lives of patients through better access, research, and education. IPC plays an important role in advancing global efforts to enhance treatment and support for people with psoriasis. As president of the Psoriasis Foundation of the Philippines and an IPC counselor, I'm committed to align local initiatives with IPC's global mission, ensuring that Filipinos with psoriasis receive the care, awareness, and support they deserve. Through collaboration and advocacy, we can make lasting changes for the psoriasis community. I'm also honored to have co-authored the first Philippine Psoriasis Registry or the PFPI SOR-Reg, which provided important insights into psoriasis demographics and access challenges. More recently, I had the privilege of working alongside Dr. Veralio and Dr. Trino, my co-IPC counselors in the Philippines, on the recently published Philippine Psoriasis Registry or PPR. This registry offers real-world data to help shape policies, improve treatment strategies, and strengthen patient advocacy. To address these challenges, PFPI launched key initiatives focused on treatment access, patient support, and awareness. The psoriasis or the PFPI SOR-Reg registry, which began in Mindanao, has now expanded nationally, providing essential data to guide policy making and improve treatment access. Our Psoriasis Health Innovation or SORHI program trains healthcare providers and connects patients with specialists, especially in underserved areas. We also lead public awareness campaigns, including World Psoriasis Day, to educate communities, reduce stigma, and empowering our patients with psoriasis. Psoriasis affects about 2% of Filipinos, and that's 2.2 million Filipinos. But many cases go undiagnosed, especially in rural areas. One major challenge is healthcare access. Half of the population has no nearby healthcare facilities, and there is only one dermatologist for every 100,000 Filipinos. Treatment is also expensive. Most patients pay out of pocket, and insurance coverage is limited, making it hard to afford long-term care. The geographic challenges in the Philippines are mainly due to its archipelago, with over 7,000 islands, making it difficult to evenly distribute healthcare services. Dermatologists and specialized healthcare facilities are mostly concentrated in urban areas like Manila, Cebu, and Davao, leaving rural and remote communities with limited access to specialists. Financial constraints are another major issue because psoriasis treatments, especially biologics, are expensive and not widely covered by insurance. The Philippine healthcare system relies heavily on out of pocket expenses, and many patients cannot afford long term treatment. Lastly, limited resources stem from the lack of government prioritization for psoriasis as a non communicable disease or NCD. Unlike conditions like diabetes or hypertension, psoriasis has not been fully integrated into national healthcare program, leading to scarce treatment and restricted access to advanced medications. These challenges highlight the urgent need for policy changes, improved healthcare access, and stronger advocacy for psoriasis patients in the Philippines. Expanding access to psoriasis care is a key priority, especially in underserved areas like Mindanao. To address this, PFPI launched two major programs. The Psoriasis Health Innovations or SORHI program trains local health workers and connects patients with providers, ensuring care reaches communities with limited specialist access. We also established community and support programs like the Psoriasis Club at the Southern Philippines Medical Center in Mindanao, offering livelihood programs, health education, and support meetings, creating safe spaces or venues for patients. Through World Psoriasis Day, we continue to raise awareness, advocate for better policies, and promote early diagnosis. Together, these efforts bridge healthcare gaps and make psoriasis care more accessible to Filipinos. These strategies align with global best practices in psoriasis care and help ensure that Filipino patients receive the support they need. Psoriasis Foundation initiatives go beyond advocacy and directly engaging patients and training healthcare providers. Through these efforts, the Foundation continues to bridge gaps in care and empower the psoriasis community. Now, what is the role of the psoriasis registries in psoriasis care? Our 2018 study searched the demographics and clinical profiles of psoriasis patients, while the 2024 studies expanded this data showing treatment patterns and access issues, emphasizing the need for better care and policy support. These registries help guide treatment, support policy advocacy, and contribute to global initiatives like Psoriasis Global Atlas, ensuring Filipino patients are represented in international research. The recently published Philippine Psoriasis Registry or PPR study provides a broader national perspective, while the PFPI SOREG focused on Davao City in Mindanao. Both registries report similar patient demographics with an average age around 40 years and a slightly higher number of female patients. The PPR includes more diverse regional data, highlighting wider national coverage. These findings confirm consistent psoriasis trends across different regions, reinforcing the importance of real-world data in guiding treatment and policy decision in the Philippines. Both the 2018 and 2024 registry studies confirmed that chronic plaque psoriasis is the most common type. Additionally, psoriatic arthritis cases have shown an increasing trend emphasizing the need for earlier diagnosis and intervention to prevent long-term joint damage. These demographic insights help guide clinical decision-making and resource allocation. Our studies also found that psoriasis is frequently associated with other chronic illnesses. The most common comorbid among Filipino psoriasis patients include hypertension, diabetes, and dyslipidemia. These findings reinforce the need for a multidisciplinary approach to psoriasis care, ensuring that patients receive comprehensive treatment for both their skin conditions and other health concerns. Despite medical advancements, psoriasis treatment in the Philippines remain challenging. Only a small percentage of patients have access to biologics, even when they meet the criteria for their advanced therapies. Many patients continue to rely on steroid topicals and phototherapy due to limited access to systemic treatments. Cost and insurance barrier remain key limiting factors, making treatment affordability a major policy issue that must be addressed. Psoriasis has a profound impact on patients' daily lives. Based on both registry studies, 47.3% of patients reported experiencing significant psychological and emotional distress due to their condition. Stigma, social isolation, and employment challenges are major concerns for many patients. These findings emphasize the importance of providing psychosocial support alongside medical treatment to improve patients' overall well being. The patient registry data plays a key role in advocating for policy change, supporting the Department of Health's inclusion of psoriasis in national healthcare programs, helping dermatologists tailor treatments based on patients' profiles and comorbidities, and providing real-world insights for public education campaigns to dispel misconceptions about psoriasis. These applications reinforce the importance of patient registries in shaping psoriasis care. Moving forward, we aim to expand the registry to include digital health tracking and improved data collection. strengthen collaborations with local health workers in underserved areas, increase training for healthcare providers using registry insights, and advocate for stronger policy support through data driven research and engagement with policymakers. These efforts will further improve psoriasis care and accessibilities in the Philippines. In summary, improving psoriasis care in the Philippines requires a data driven and collaborative approach. Using real world data helps develop better treatment strategies and support policy changes. Strengthening local and global partnerships is very important to expanding access to care. Call to action. I encourage stakeholders to support evidence based advocacy to improve psoriasis care. Collaboration with global partners like IPC is essential to advancing research and making treatments more accessible. Healthcare providers, policymakers, and patients' organizations like Psoriasis Philippines or SORFIL must continue to work together to raise awareness, promote early diagnosis, and improve patient care. Through collective efforts, we can make psoriasis care more inclusive, accessible, and effective for all Filipinos. Thank you for your time and attention. For any follow-up questions, feel free to reach me at bpguiliano@usep.edu.ph. Shout out to my colleague, Dr. Andrea Contreras, for helping me with this presentation. Again, thank you, IPC, and I truly appreciate this opportunity to present and share our work in improving psoriasis care in the Philippines. Mabuhay!